Halo, Assalamualaikum warahmatullahi wabarakatuh. My name is Frima Ulfa Agustina. I am from Faculty of Nursing, Universitas Indonesia. I want to present my research about the determinant of nurses safety attitude in the hospital. Nurses safety attitude is one of the important factors that influence the implementation of patient safety. Nurses attitudes will affect patient safety implementation 13.940 times positively. Nihayati Gunawan Wahyuni and Purwanza 2019. But the nurses' attitude towards patient safety in the hospital is still not good. Boucher et al. 2019 found that the attitude of 4,424 nurses who were positive towards patient safety in 4 Palestinian Gaza Strip hospital was only 41.9%. Research on 185 nurses in a government hospital and 120 nurses in a private hospital in Jambi, Indonesia found that positive nurses' attitude towards patient safety were only 45.48% and 56.22%. Bukhari, 2019. The observation results on the implementation of patient safety procedures in a government hospital in Jakarta from September to December 2009 were good. However, the results of the questionnaire analysis on 176 nurses found that 100 or 56.8% nurses had poor patient safety knowledge about patient safety. Even though the more nurses knowledge about patient safety is, the nurses safety attitude will be more positive. Delikuti et al. 2018. The interview results with a nurse at the hospital in December 2019 found that some patients was falling during 2019. Patients who were falling were patients who have not falling high risk. So it could be assumed that nurses compliant with standard operating procedures or SOP is not good. Safety attitudes are also influenced by the way nurses comply with applicable policies and standards. Kwon et al. 2019. The phenomenon found in this hospital reflects that nurses' attitude towards patient safety are still not optimal due to various factors. The influencing factors need to be identified because the nurses' safety attitude is closely related to their responsibilities regarding patient safety issues when providing nurses services and can prevent patient safety incidents from occurring. Lei, Huang, Hu, Su, and Wu 2016, Tetuan et al. 2017, and Tilgar et al. 2018. There has no research on the determinant of nurses' safety attitude is also be a basis for this study. Based on the background description, the researcher is interested in identifying the factors of influencing nurses' safety attitude in the hospital. The method that used in this study is quantitative study. Use a cross-sectional design that was conducted on 376 nurses of 668 nurses who work in a government hospital in Jakarta and taken using a purposive sampling method. The researcher upholds ethical principles, and this research was conducted after receiving a passing letter of the ethical review from the Faculty of Nursing Ethics Committee Universitas Indonesia. The data were gathered using questionnaires that developed and modified from various standardized instruments. The result of the instrument validity and reliability test of this instrument show that they were valid and reliable. That were analyzed by bivariate and the structural equation model or SEM method using the SMART PLS application as multivariate analysis. The results of this study show in tables and figure. Table 1 show that there are relationships between age, work experience, job satisfaction, workload, work stress, working condition, and head nurses management function. But there is no relationship about between working hours with nurses' safety attitude. In table 2, show that there is a relationship between gender, clinical nurses career path, patient safety training, but there is no relationship between nurses education and work units with nurses safety attitude. In figure 1 in our model, the structural equation model or SEM in smart PLS application shows there is a relationship between job satisfaction, workload, work stress, head nurses management function, and working conditions with the nurses safety attitude after going through validity and reliability tests in smart PLS application. In table 3, shows that there is a significant relationship between job satisfaction, workload, working stress, head nurses management function, and working condition with nurses safety attitudes. This relationship is found by following resolution equation. There is two equation. Equation 1, safety attitude is 1.000 job satisfaction, and equation 2, safety attitude is 0.701 working condition minus 0.776 workload plus 0.576 head nurses management function minus 0.634 work stress. The prediction model in equation 1 and 2 state that the most dominant factor in determining nurses safety attitudes in workload with minus 0.776 original sample value or O, which means that each increase in nurses workload, the safety attitude will decrease as much as 0.776 times after controlling for working stress, working conditions, head nurses management function, and work stress. Increasing the nurses' workload will negatively affect the nurses' safety attitude. Bresaite et al. 2016 and Lilikuti et al. 2018 state that a heavy workload will negatively affect patient safety. An increase in workload leads to lower quality of care and patient safety. A decrease in safety attitude followed by a decrease in the quality of care and the occurrence of error in patients was caused by an increase of 74% in the nurses' workload. So this should be a concern of hospital management. Hospitals have a different goals at the same time, namely excellent service to patients, optimal quality of care, operational excellence by using human resources as optimally as possible. This means that hospital also need a good balance between patient needs and the nursing staff workload. So the conclusions of this study is patient safety attitudes are very important to maintain the quality of care services provided to patients. There is a significant relationship between age, gender, work experience, clinical nurses career path, job satisfaction, workload, patient safety training, work stress, and working conditions of nurses with the safety attitude of nurses in the hospitals. The greatest influence factor of nurses safety attitude in the hospital is workload. Nurses who have a high workload are 0.776 times more likely to reduce the safety attitudes of nurses in the hospital. The hospital needs to pay attention to those factors because a negative nurses safety attitude will have an impact on the quality of nursing services and patient safety. Acknowledgement, the authors are grateful to Hiba Putih 2020 funded by DRPM Universitas Indonesia. So I think that's all my presentation. Thank you for attention. Good morning.